Hi everyone, my name is Shipra, and over the past 2 years, I've had the privilege of working alongside Dr. Meredith Vanstone and her team on a large project about cannabis use during pregnancy and lactation. Today, I will be presenting the results of a qualitative study of information use titled Making Informed Choices About Cannabis Use During Pregnancy and Lactation. So, rates of cannabis use during pregnancy and lactation continue to increase due to changes in societal attitudes, legality, and perceptions of risk. Pregnant and lactating people may use cannabis to manage a variety of symptoms that occur before pregnancy, as well as those during pregnancy, such as nausea and vomiting. Clinical guidelines caution against the use of cannabis during pregnancy and lactation due to the scientific evidence indicating potential risks of harm to the child and mother. Given this, pregnant and lactating people are faced with challenging decisions when weighing their perception of benefits against the potential risks of perinatal cannabis use. As with other complex decisions in pregnancy, the availability and content of information is essential in making an informed choice. Healthcare providers can have an important role in the facilitation of informed choices by providing relevant, accurate, and comprehensive information that is meaningful and understandable to patients. But they might not know what information patients will find helpful. Our objective was to explore the self-identified information needs of pregnant and lactating people when deciding whether or not to use cannabis. We aimed to describe the modes and sources they used in their information seeking and their satisfaction with the information they found. This was a secondary qualitative description analysis of semi-structured interviews from a large study investigating pregnant and lactating people's decision-making around cannabis use. After obtaining institutional ethics approval, we recruited Canadian residents who made the decision to start, stop, or continue using cannabis during pregnancy and lactation. They also needed to have the ability to communicate in English and be 19 years or older. We recruited participants from social media and prenatal clinics in Canada. Participants completed one semi-structured interview with one of 4 female interviewers on Zoom. During the interview, participants were asked about the information they sought out or encountered when making a decision about cannabis use, the sources they accessed, and how they evaluated the information they found. We analyzed the data using an inductive approach to conventional content analysis. This focused on identifying any aspects of information use that participants discussed as part of their cannabis use decision-making. So 52 participants participated in the study. 30 of those were pregnant and 22 were breastfeeding at the time of data collection. We had a diverse sample of participants with varying ethnicities, education, occupation, and geographical locations in Canada. We found that most participants described deliberate information work as part of their decision-making process. This can be described in categories of information needs, information-seeking strategies, and satisfaction with the information they found. So, what do pregnant and lactating people want to know about cannabis use? Pregnant participants wanted clear, consistent information about the risks of consuming cannabis, which included harms during pregnancy, such as miscarriage, and harms to the infant. Breastfeeding participants, or those that were soon to be breastfeeding, had specific questions such as how cannabis transfers through breast milk and the potential impacts on the baby. Many participants who perceived benefits from cannabis wanted clear information about the optimal dose, timing, and form of cannabis to use to continue receiving the benefits of use while reducing the risks of harm. Many of them mentioned wanting clear information about cannabis, similar to information available about other substances, such as alcohol or cigarettes. Pregnant and lactating participants consulted a wide variety of sources, which can be grouped into 2 categories of online sources and known people. Many participants used online sources to find information. They described Googling cannabis and pregnancy or cannabis and lactation to find any information. They also mentioned consulting with discussion forums in Facebook mom groups, on pregnancy apps, or websites such as Baby Center, Health Canada, or Mayo Clinic. A few participants also used PubMed and Google Scholar to conduct these searches to find any relevant scholarly information. Some also mentioned finding information from the news or media when results were shared with the public. Pregnant and lactating people also obtained information from people known to them, such as family, friends, or clinicians. This included drawing on personal experiences that their friends or family members had with cannabis use during pregnancy or lactation, or having them help in finding potential sources of information. Only a few participants mentioned obtaining information from their healthcare provider, while many others discussed that they were reluctant to disclose their cannabis use due to the fear of stigma as well as the fear of potential legal consequences. Throughout their information work, there was a general consensus from the participants that the scientific information they found was insufficient. Participants found that the information online was conflicting and difficult to interpret. Particularly, the research studies they encountered were difficult to understand, navigate, or read, as well as the findings often had cannabis grouped with multiple substances. The lack of information led to some participants to cease their cannabis use, while others relied on anecdotal evidence from family, friends, or anonymous mothers online to make their decision. Overall, we found that pregnant and lactating people spend a lot of time and energy trying to find information when making a decision about cannabis use during pregnancy and lactation. There is a distinct need for information related to risks, long-term effects, and methods for safe use for those who perceive benefits from cannabis use. Healthcare providers can use these findings to recognize the complexity of this decision and understand that patients may have certain reasons for wanting to continue using cannabis. They can also recognize the amount of time and energy they spend in trying to find accurate scientific information. As some patients may have discomfort in disclosing perinatal cannabis use, healthcare providers could offer information proactively in the form of knowledge translation or decision aid tools. Thank you so much for listening to this presentation about informed choices about cannabis use during pregnancy and lactation. If you have any questions or would like more information on this study, you can contact my wonderful supervisor, Dr. Meredith Vanstone, at the email on the right side of this poster presentation. Thank you.